Hi everyone, welcome to Research MD. This is Dr. Pramil. Thank you for watching our videos. Today we're going to continue our presentation. We did some of the lab tests, what we have to do, right? Today we're going to go another important about the CT scan. Before we do that, let's give a spin to our globe. I think we have to put it on I think there's a curve, 20 degrees. You cannot just put the globe right here. We put a curve and spin it and find out where it's going to end. Somewhere in the ocean. I don't think anybody there. Somewhere in the northern sea. Okay, I don't know if anybody's over there. Send us any, put it on the comments. But again, today the topic is, your doctor called you and said, hey, we need to do a CT scan, right? We call it CAT scan, or like that's the one we're going to say. Anytime you do a test, the first thing you should ask the doctor, what's the first thing you should ask the doctor? Doctor, this is a test. I know the radiation is involved, right? And how much radiation am I going to get when you have a test like this, when you order? Doctors, they're great doctors. There's nothing wrong with them. Sometimes they want a quick result so fast and they don't think about the consequences. Okay, so first thing you always ask, doctor, by doing this test, can anything happen to me? Is there a risk of radiation? All right, so first question you should ask is what? Is there a radiation risk? So if you do, somebody ordered a CT scan or computer tomography scene, we call it CAT scan. The first thing you should ask, hey doc, am I exposed to radiation? Okay, as you are exposed. When we look at the radiation, we will say we compare to a chest x-ray. How many chest x-ray is equivalent to when somebody go through one CT scan? That's the normal way we measure, okay? Chest x-ray, just a little bit of radiation. But how many of, your question is like, doctor, can you tell me the radiation equivalent to how many chest x-ray it is, okay? In CT scan of the chest, it's equivalent to 70 chest x-rays. So all of a sudden you're doing if I told you I have to do 70 chest x-ray on you, will you do that? No, right? You say no way. If you come to me as a doctor and then I ask you, I'm going to do 70 chest x-ray on you. What's your reaction? You will run, right? Forget it. I don't care. I'm okay. The same thing when you do a CT scan is equivalent to 70 chest x-ray. Okay, but you could ask, but let's say if you do, that's only for the CT scan of the chest. And then when you this is what happened. Constantly people have abdominal pain. They go to the emergency room. What's the first thing this ER doctors do? They do a CT scan because they want the results out. Imagine here are 100 patients coming to they have to see 50 to 100. They come to the emergency room. They want you to out of there, or they have to make the decision to admit. Okay, ER doctors are smart, but so many other things they have to do. They're not like regular doctors. They focused on the short-term management and then decide to admit, right? So they have a tendency to do a large number of CT scans. So be careful when you go to an emergency room. When they ask for a CT, first thing you should ask, doctor, is there any other option I have? Can you get an ultrasound of the abdomen and see first? Can I get some of the results? That should be the first question. The reason I see this all the time, and I don't want you to unnecessarily get exposure to radiation, okay? But as long as, this is not too much radiation and the risk, but I would be worried. That's why I'm spending so much time to say that. So the first question, doctor, am I getting any exposure to radiation? How many chest x-ray is equivalent to? The third question is can I do an abdominal ultrasound to do that? Okay, so abdominal ultrasound, abdominal CT scan is much more than 70, okay? So we have to say it's not the same as doing a chest CT. Now let's look at it. Abdominal, it's equivalent to almost 200 chest x-ray. Okay, when you go, again, I just have to stress this again and again. When you do an abdominal chest x-ray, it's equivalent to 200 chest x-rays. You can always do an abdominal ultrasound first. Okay, Now you've taken care of all of that. You go to this place, radiology center, you started, like, what are the things we should be prepared for? Okay? First thing, there's two types of CT. One, you give contrast. They ask you to drink something and it light up the area. It goes wherever the vessel sees, so you can see very clearly. Okay, that's called contrast. So you need to make sure the doctor, you could ask them, is this a contrast CT or non-contrast CT? Okay, some of the things, let's say you got kidney stone, non-contrast is better. Okay, now when you want like a clear picture of the abdomen, the contrast CT is better. Again, this contrast can cause kidney damage also. You have to be very careful. So always look into the slip and see, did your doctor ordered contrast or non-contrast CT? Okay, if it is not there, call the doctor and say, doctor, are you going to do a non-contrast or contrast? What is contrast? It's a dye. It's kind of like iodine dye. You have to drink it and it goes into the vessels or wherever, it light it up. They can see clearly. The radiologist can say, look at the vessels and say, like, let's say you got a blood clot in the lung. So they can see in this blood vessel, you have this. Okay? So remember, you have to know the difference. Is it a contrast versus non-contrast? And then they will have given instructions and all of that. Okay? Now, should I drink alcohol? That's a lot of people are drinking alcohol, but don't do it because it can cause dehydration. When you have dehydration, when you have to do contrast CT, again, I told you it can affect the kidney, right? When you dehydration, kidney function can be affected, so don't do that. I would stop 2-3 days before alcohol. What medication to avoid? Most of the medication you should be okay, but if you're taking ibuprofen, all that I would avoid because that can affect your kidney, right? That's why we tell people take Tylenol. So if you're taking ibuprofen, don't take it for at least 2 weeks before ibuprofen or any of this thing called NSAID because that can affect the kidney function. Okay, if you have diabetes, sometimes people are taking metformin and all of that, but check with your doctor before, can I stop it and all that, okay? If you're on diuretics also, like a Lasix, anything kind of causing you can low blood pressure, or can be very careful. But again, I'm going to too much detail. That's your doctor's job, not my job to teach you, not your job. Your doctor has to decide, okay? Don't make the decision unless you're a professional. Everything I say, you have to go and check with your doctor, okay? Because if I'm near you, I could tell you, but if I don't see you, just don't, this is a guidance for you. Take it as a guidance or like advice, but it should be verified by your doctor. Now, next question, if I'm pregnant, can I take it? No, don't do that. You can radiate. Not only you, radiate your, baby also. Okay, don't do that. But what can you do? You have, you can do an ultrasound or you can do an MRI. MRI might costly, you might have to pay. If you can do an MRI, I would rather do an MRI. Definitely ultrasound. And what kind of things I should wear? Always wear loose clothes, which relax. No metals, jewelry, metal object, hearing aid, glasses. A lot of things that people forget. Let's say if you have surgery done and they replace some of the bone with some screws and all of that, and you cannot do. Some of the implants in the body, right? Anywhere in the body. Sometimes they do an x-ray to find out, is there any, a lot of people don't remember, right? What happened, you might have like fracture, what they did and all that. Sometimes they do this x-ray to find out like what's going on. So you need to understand, make sure you don't have nothing in your body. Like a pacemaker is the main thing. Some of the new pacemaker, if you are getting a pacemaker, tell them it's MRI comparable, okay? Otherwise you won't be able to do. That's a big problem, okay? Now, what else we can do? Like, what kind of things I need to take care? Like, make sure you drink plenty of water. You don't want to get dehydrated. So sometimes this can cause allergic reaction. The iodine dye known to have allergic reaction. Okay, so always check with your doctor. If you have allergic to iodine, then you can have a problem. Okay, so remember that. Iodine, I've seen like a lot of people, but what they do, they have this cocktail, they'll give it to you before, like some steroids to make sure you don't go into allergic reaction. Because if you go to allergic reaction, it's very, very bad. Okay, make sure you talk to your doctor and say, hey, I don't have any allergies, especially iodine allergies, okay? So all this contrast, anytime you have somebody given a contrast and you had an allergic reaction, you should tell the doctor, okay? So what activity you do after that? If no contrast dye was used, you can do your normal activities. But if contrast is used, make sure you drink plenty of water to flush in the system because it can affect your kidney. So what I recommend, if you get let's say you get a CT scan of the contrasts, right? Make sure your kidney function is okay. If I'm you, maybe 1 week later, get a BUN creatinine, renal function, just to make sure you didn't touch it, because you need to protect your kidney. Once the kidney is gone, you don't want to go to kidney transplant, right? So it's like it's a less than $100 test on creatinine. Doctor, can I take a creatinine just to make sure it's okay? Right? I mean, all of these things are very, very important. Please pay attention to. And if I'm not a doctor, you're not going to know. A lot of people don't know this. Like, I know, like, some people, they just want the test. They don't care. Like, oh yeah, doctor, my doctor ordered this test and they're very happy. But don't be in that situation. Worry about complication. Make an intelligent decision. Thank you so much for watching. We want to make more presentations like this, so we need your full support. Send the videos to your friends. Put it on YouTube, put it in share the video, put comments. Comments can help us. What your experience, so other people will know. Okay. Thank you very much, and God bless.